So this photo is what I found from a journal article that was the most similar photo that I could find that represented the situation that I had. So she's 60, and she actually called my clinic and said, you know what, I think I might be having a complication from my Botox. And I apologize, I'm going to probably use the word Botox for simplicity, but it could be any neuromodulator. I don't have any favoritism for one brand or the other. But she called and she said, you know what, I had Botox there, and I'm worried that I'm having a complication because over the past couple days, my smile looks a little bit asymmetrical and my eye is a little bit dry. So those are what she described. You know, we looked at her chart. Yeah, sure enough, she had her Botox treatment 2 weeks ago in the clinic, and we treated her frown lines, we treated her forehead, and we treated her crow's feet. And so that's the information. So I just want you to think about in your clinic, if somebody were to call or to walk in, how would you handle this? What questions would you ask? Because I do this differently now. So question number one, what am I looking at? And what am I worried about? So you might say, okay, I think she may have a little mild eyelid ptosis. You can appreciate on her left eye, it might be a little droopy. She didn't actually complain about this. Her complaint was that her eye was feeling a little bit dry. She can't lift up the corner of her mouth. So, you know, three big things come to my mind. So the first thing obviously is, okay, well, is this a Botox complication? Is this what we're dealing with? Is this a stroke? Right? Like this is an emergency if it's a stroke. And I know we talked about neuromodulator complications not really ever being an emergency, but I'm worried. I'm like, could this be a stroke? Or maybe this is something like Bell's palsy, right? Or maybe it's something else. But these are the three things that immediately came to my mind that I needed to kind of sort out right away. So we brought her in right away to examine her. But this is when I'm looking at those three scenarios, this was my thought process. And I tried to figure out what the best way to communicate this was. I put this in a table, but this is really, what I'm thinking through. And so what do I need to know? What information do I need to know? So if we look at, okay, well, when did this start? So she said it started over the past couple of days. So it's kind of in your timeline for a Botox complication, right? Like kicks in like 5 days, max 14. Then I think about, okay, well, what about a stroke? Stroke is an acute onset. People wake up with these symptoms. It happens quite quickly. So this person is describing symptoms that progressed over a couple of days. So I'm feeling a little bit reassured that way. Then I'm thinking, okay, could this be Bell's palsy? So Bell's palsy will typically present with symptoms for over 72 hours-ish. So, okay, that's in the running as well. Then I want to look at, okay, let's look at her facial weakness again, right? And let's look at the patterns. So if this is a Botox complication and somebody has weakness, like where would I expect it to be? Really depends on where you inject it. And for her, we've injected it pretty much everywhere, frontalis, crow's feet, in her glabella complex. So your pattern of facial weakness in a Botox complication is really dependent on where you inject it. The key here is, okay, if I'm looking at a stroke will affect the lower part of the face only. And Bell's palsy will be both the upper and the lower part of the face. So that's a key differentiating factor between an emergency stroke and maybe an urgency. Like Bell's palsy is an urgency. But I'm trying to decide, like, do I need to send this patient to the hospital? Other things that we can think about are sensory loss. Like, can they feel their face? If you have a Botox complication of weakness, you don't lose any sensation, so you can still feel your face. And a stroke, you may or may not have some sensory loss, but in Bell's palsy, you will not. And then we start thinking about, okay, is there anything else I need to ask? So if I think she had a stroke, Do I want to know about, do you have any difficulty swallowing, difficulty speaking, slurred speech, any weakness in your upper or lower extremity? So all those screening questions that our emergency systems will ask or ambulance will ask when you call. And then you can ask about other sensory symptoms like taste. So taste might be affected in Bell's palsy. Hearing, you have hyperacusis in Bell's palsy. And then you can think about the other things down the list are, do they have any infectious symptoms? So with a botulism toxin complication or stroke, there's generally no infectious symptoms. Bell's palsy, you might. But the key here, and this is what's really muddying the waters, is that I'm trying to decide, am I worried about a stroke or not, right? We want to know, is this an emergency or not? And really what would help me is knowing the movement of her frontalis muscle. But I've Botoxed her frontalis muscle. So, this is really a tricky situation. So just to recap here, in this patient, she doesn't have any movement of her frontalis muscle. She's not complaining about this. This is not a presenting symptom or complaint of hers because she's had Botox in her frontalis. So she doesn't even really, think anything about that. So I've put Botox there. So I can't use that as a measure to determine if I'm worried about a stroke or not. And then whether we call this an eyelid ptosis is maybe what you would call it if you were seeing this in your cosmetic clinic, but it really, she has some weakening of her whole orbicularis oculi and her ability to contract her eye. And so I don't have a good picture of this, but if you ask them to close her eye really tight, she had a hard time really shutting it. But I've put Botox in that muscle, right? So then you want to think about, like if I put Botox in the orbicularis oculi, well, maybe it's weak, shouldn't be weak all over. And I've put Botox in her frown line, so in her corrugators. So I guess potentially it could have spread and it could have caused a mild brow ptosis. She can't raise up the corner of her mouth. So, I guess potentially, right? You've put Botox in the orbicularis oculi muscle that can diffuse and spread down the cheek and maybe. So I'm thinking this could be Botox. This could be a Bell's palsy. It could be a stroke. So I have a little bit of clues here, but the point is that somebody's come into your clinic and just think about other things that it could be just because they're complaining of a Botox complication. We really have to make sure it's nothing else. I don't want to bore you with the neuroanatomy or pathophysiology of stroke and Bell's palsy, but I'm like a total geek when it comes to this. So I just, threw that out there. And it's just to show you that the reason why you have movement in your forehead muscle if you have a stroke is because your forehead muscle is innervated by both sides of your brain. So that's an upper motor neuron problem, a stroke. So you'll still have movement in your forehead, whereas something like Bell's palsy, that's a lower motor neuron problem at the level of the facial nerve. So that's why your whole side of your face is affected in Bell's palsy. And there's other causes of facial paralysis that we will not go into. That's not the point of this conversation, but it's just to highlight like all of these other potential things that it could be. So what do you do next? So in this situation, really, I was not reassured that this was a Botox complication at all. I thought that this was, either I have to treat this as a stroke or a Bell's palsy. And I ended up sending her to the emergency room. Fortunately, I have privileges at my local hospital and I work there and I was able to manage this. But that doesn't mean that the expectation is for you to do the same. The point is just to recognize I'm worried about an emergency. I'm worried about a stroke. And I think that this patient is best served with further investigation. So she didn't have a stroke in the end. This was a Bell's palsy case and she was treated as such. But that's what do I do next based on all of that information? I think the real curveball here is that I put Botox in her forehead. So I couldn't really reassure myself that she wasn't having a stroke. So I know neuromodular complications are not always like super exciting to talk about, but this really changed the way that we handle inquiries in our clinic. And the screening questions that we ask if somebody were to call and to come in. So just think about it in that way. Like, what do you do when somebody calls with this type of thing or walks into your clinic? And what are the things that you think about, and what are the questions that you ask?